In August of 2020, the World Health Organization declared Africa to be wild poliovirus free. This was a major victory, but the fight against polio has not yet been won. We are still finding many cases of vaccine-derived poliovirus across the continent. Vaccine-derived poliovirus is a strain of the weakened poliovirus that was initially included in the oral polio vaccine that's widely used across Africa. This strain can change over time and behave more like the wild or naturally occurring poliovirus. In under-immunized areas, it can be spread to people who are unvaccinated against polio and who come in contact with the stool or respiratory secretions, such as a sneeze, of an infected person. We now have access to a newly introduced polio vaccine that is expected to decrease the incidence of vaccine-derived poliovirus. Amid all of this, the world was, and still is, in a global pandemic. Unfortunately, other diseases don't simply go away just because one disease, in this case COVID-19, has become the most prominent globally. If anything, the pandemic has made it more important to fight other illnesses that can exacerbate the effects of the pandemic. This is what led to the push to build Immunization Coordination Centers, also called ICCs, across priority countries in Africa. They were urgently needed to increase emergency preparedness in managing, collecting, gathering, analyzing, and using data to make decisions that protect lives. The pandemic has made it more difficult for us to travel across the continent, but it's also made it more important for us to build these life-saving facilities. We've worked closely with our partners, the Bill and Melinda Gates Foundation, Voluntary Service Overseas, and the governments in each country that we've worked in to accomplish the construction and refurbishment of 9 ICCs in a very short time.
Setting up an emergency operations center in the middle of a pandemic with resultant global travel restrictions was a different kettle of fish entirely. However, as an organization, we were able to demonstrate our resilience by kicking off the project in June 2020. We started by holding virtual meetings with stakeholders, as part of the remote approach to implementation of the project. Further to this, we were able to do some physical assessment to validate our initial remote needs assessment around September when the global travel restrictions were lifted. In addition to this, as we made progress with validation of our needs assessment to begin interventions that have resulted from the gaps identified from the needs assessment that we did, was a request by the donor and our prime partner, Voluntary Service Overseas, that instead of the phased approach that was initially planned for the project to be implemented, such as delivering 3 emergency operation centers in 1 quarter and 6 within 6 months. There was that request that we should deliver the 9 EOCs within the same period. This was quite challenging. But then, as an organization that is always responsive to public health emergency and the needs of our donors, we were able to deliver within the same period. And at the end of the day, within 9 months, we were able to deliver between September 2020 and April 2021. We were able to deliver all of the 9 emergency operation centers, within 9 months, and they are all functional and have become useful resources for these countries, even as they continue to manage polio and other public health diseases.
Setting up an emergency operations center has always been one of the most exciting aspects of my job throughout my career at eHealth Africa. Watching stakeholder initiative getting implemented in such an organized manner that it produces such a facility that supports health system strengthening across Africa was simply awesome to see. One of the major challenges we faced while setting up the EOC in Liberia involved weather conditions, and this was simply because we worked within a 30-day timeline to complete the facility during the rainy season. This, of course, affected renovations work, but despite this challenge, we still were able to complete our milestones and meet the deadlines required. It was indeed an exciting experience.
The construction of the ICC in Cote d'Ivoire was just before a presidential election, with the political crisis in various hotspots. After a security briefing and approval, I went to start the work in that atmosphere. The approved construction site was changed 3 times, which changed the scope of work multilaterally. This involved various meetings with different stakeholders and with VSO, our primary partner. it was very challenging, especially because the building that was finally selected to put up the ICC in was over 50 years old, dilapidated, and even had a tree growing in it. It was in ruins. The building was almost practically demolished, the entire roof and ceilings removed, floors excavated, and office spaces merged to enable the ICC to be built. We achieved a milestone in having the government buy into the project and commit financially to it. After the ICC structure was completed and equipped, the transformation was so impressive that it became the regional EOC for some surrounding countries, and major decision-making meetings at high levels are now scheduled to be held in the ICC. The construction of the ICC in Congo-Brazzaville came with its own unique experience and challenges for me. It was working under very intense pressure. The work was stalled for almost 2 months because of the inability of the country to receive international transfers that were paid to selected vendors for the ICC project. Partners were all on ground, ready to receive materials and kick off with the campaigns. The donor gave tight timelines to have different sections of the ICC completed for different decision-making meetings. The pressure concerning the non-receipt of funds by vendors was so intense that the project manager, Kazim, had to come in to have meetings with senior stakeholders. Unplanned financial solutions were proactively put in place by him after the process and approvals to ensure the work continued. The conference hall had to be completed first, as this was the intended venue for the scheduled meeting between stakeholders and decision makers. They were amazed at the speed, proficiency, and efficiency with which we worked to get the ICC completed within the set timeline. It was like holding one's breath for many months. In the end, they gave high commendations at the speed of work, quality of furnishings and equipment, and the resources put in to ensure that the project was a success.
When setting up an ICC center in a particular country, it's very important to work very closely with partners that are involved in the project to identify the best location to be used as a construction site. It's also important that you work closely with partners to identify the scope of work, what needs to be done, and what is required in such a building structure. When all this have been decided, the next step is to identify a suitable vendor based on reputations and records kept by partner organizations. A professional construction vendor can be easily identified. Upon selection of a reputable construction vendor, next steps will involve starting up construction works. It's very important to ensure that the project is being supervised and monitored by experienced professionals, just to ensure that expected quality standards are being met, and that the standards also conform with the expectations from partners and all parties that are involved in the project. So upon final completion of construction works, a final round of quality checks are being made to ensure that all is put in place, and areas that require touch-ups are quickly identified and also corrected to ensure a smooth handover.
My name is Wilson Inalegu, and this is my story on the construction of a polio immunization center in South Sudan. I left Nigeria in October 2020 for South Sudan with the initial scope of work being to use a prefabricated steel container as the Polio Immunization Coordination Center, ICC for short. And a vendor had already been engaged to carry out this responsibility. However, the scope changed when I arrived Juba to construction of a building. With the change in scope of work, the whole process of vendor identification for building construction, office appliances and furniture power generator, and high-speed internet access with high-tech IT devices had to be redone. Construction started in December 2020 after input and proper approvals from the appropriate government agencies. A lot of activities were run concurrently during the construction due to the tight time constraints, ensuring we were still in compliance with standard practices. Most challenges were resolved quickly as all stakeholders were most times on site and would quickly discuss challenges and recommended solutions. This is a mirror of what is expected to be achieved using the ICCs, as all stakeholders would resolve polio-related challenges using data obtained from various components of the polio ecosystem. The building was completed and equipped in May, while the commissioning was chaired by the South Sudan's Minister of Health on May 8, 2021.
When I arrived in Yaoundé, Cameroon, there were so many back and forth meetings before the government proposed the facility to be upgraded as an abandoned cold storage building. So there was a need for evacuation of all the old equipment and proper cleaning even before the civil construction vendor was engaged. EHA's standards regarding quality delivery and impact were all taken into consideration during the vendor selection and other procurement processes, despite the COVID-19 restrictions in Cameroon. The initial civil renovation plan began successfully, lasted for about 4 weeks before completion. Then the government came up with additional requests for renovation. This was proposed by VSO, and it led to 1 additional week for procurement activities and 2 weeks for renovation. That is 3 additional weeks between December and January 2021. Additional renovation took place simultaneously with the furniture, appliances, and ICT equipment installation. Some activities took longer than expected because it was difficult to achieve during the end of the year, Christmas and New Year holidays.
There were initial skepticisms from the Immunization Director, who refused to grant us access for renovation work to commence. It took a lot of stakeholder engagement between us and World Health Organization, Global Polio lead, to get the Immunization Director to accept us. Secondly, while we are on that, the entire health ministry went on a 1-week warning strike, which affected our workflow. When we finally received the quotations and processed for payment for civil work to start, there was a further delay because the vendor could not access the upfront payment as his bank was only euro denominated. It took a while to get the money across to this vendor, and this led to a substantial delay in the overall implementation.
The availability of high-speed internet and also conference room equipment is a backbone of all collaboration that takes place at the ICC. Hence, the successful setting up of IT components of the ICC is considered to be key to the overall success of the project. Due to COVID-19 outbreak, we couldn't travel physically to most of these countries to carry out the needs assessment as well as handle the installation, with the exception of Chad, where we took 100% responsibility for the setup as well as training of the IT personnel. But despite the pandemic, we were able to travel. We were able to provide guidance to the team on ground in the respective countries in terms of selection of IT vendors to handle the installation, and also engaging the ISP in terms of ensuring that the requirements are met and also captured in the service level agreement document we signed with this service provider. Due to our expertise in setting up and running multiple EOCs within Nigeria from our central location in Kano, with the help of the administrative coordinators on ground in these respective states, we were able to provide the selected vendors with the standard guidance and also requirements for installation, and also provided support in planning of the deployment as well as ensuring that network configurations meets the requirements we provided to them during the deployment. And this is also validated by logging into the network to validate the configurations. We also provided support to the team on ground for challenges beyond their expertise, such as setting up of virtual machines and also implementing bandwidth management configurations on the system, just to ensure that available resources is always used by the users of the ICC offices.
When you review recent approaches to outbreak response in Africa, emergency response actors do two things. They do the necessary things to contain the outbreak, and then they focus on building relevant systems, processes, and structures, both at the same time. This is quite difficult and contributes to the fatality rates recorded during disease outbreaks. For instance, Guinea had to set up an EOC to address the COVID-19 pandemic. Now, imagine the time lost setting up that structure and the implication for lives. But with the introduction of ICCs, a critical piece of the puzzle is now addressed. We will save more lives and improve the livelihood chances of more Africans. The countries that have benefited from our expertise in this area now have the infrastructure and skill to coordinate and monitor outbreaks proactively. They now have the tools to evaluate and analyze incoming data. They now have a center to initiate and administer vaccination campaigns. They also have a structure that lends itself automatically to disease outbreak detection and response. With this one action, we have solved deeper issues that will improve public health management in Africa. It's quite amazing.